Dr. Hoskins, how do you work with your patients to make treatment decisions? And what increasing treatment options, what should endometrial cancer patients consider when deciding on treatment?
So I think this is a good question. In terms of like patients up front, I think we follow kind of certain guidelines, if you will, in providing standard of care. And the first frontline therapy is pretty standard, right? In terms of advanced treatment. When patients recur and we have to look at alternate treatment therapies, I always look at the patient. I always look at what their medical problems are or any side effects. And of course, the data to see how well are they going to do with side effects and quality of life. There's numerous factors that are not just something looking in a book and say, okay, I'll take A, right? Like, I think we have to look at all of that and make a decision with our patients over going the side effects, the efficacy, all of these things that are in mind when we talk to patients. So my activation tip for patients would be being involved in the decision-making, asking the right questions in terms of how effective is this treatment that you're recommending? Do you think it's worth the side effects? Is my quality of life going to be affected? Can I still travel? Those are questions like we want to live, right? And I don't think anybody wants to be stuck every 3 weeks getting treatment or, so those are questions to ask in terms of like quality of life. And so those are questions that I would recommend you ask your doctor when you're deciding what treatments.